Hey guys, come along with me today to inject some cheek filler. As you can see, I have this patient marked up around that orbital rim of where I'd like to inject. I kind of just do this as a guideline of where I'd like to go. You don't have to inject directly into these dots, but it kind of just serves its purpose so you have a treatment plan. I do this by reclining the patient back at about a 30-degree angle and I look over top of them. So I am looking from the frontalis down to see where the patient is deficient. I usually assess and ask the patient also what side of their face they sleep on, because usually that is the side that I'm going to start on. It's the side that has more of a deficit, therefore it's going to probably use a little bit more filler. So as you can see, I am injecting at a 90-degree angle. I am going down straight to bone. I am making sure I'm hitting and riding on that bone, and when I am there, I am then doing a thorough aspiration. I'm aspirating for a couple seconds, making sure I'm not seeing any positive aspiration, and then I'm pushing a bolus of product. I am not pushing more than 0.1 at a time, and then when I come out, I am wiping that area clean, checking capillary refill, and assessing for signs and symptoms of vascular occlusion. On this injection technique right here, I am going at a submandibular approach. This just helps pick up the apple of that cheek a little bit more. I always like the effect that it has. It just allows that apple to look really full when the patient is smiling. This injection is a little bit more high risk than going at a 90-degree angle, but it is worth it if you are injecting safely. So here I am moving to the other side and I am repeating the process. I am again injecting at a 90-degree angle. I always like to support underneath that needle and syringe to just kind of uplift that cheek while I'm injecting. Riding down to bone, aspirating, pushing a bolus, coming out. As you can see, the patient is talking during this procedure. It's actually quite comfortable. The pain level is pretty bearable for the results that you're getting, so that's great. We typically do not numb for this procedure. The product has numbing in it, so as you inject, the needle becomes more tolerable because of the numbing in the product. I also like to change out my needle halfway between the procedure just so the needle is sharp for each side. A sharp needle allows it to be more comfortable for the patient. Also, make sure you're educating your patient well about post-care instructions. Make sure that they're not sweating excessively, touching the area, or manipulating it in any way. I also like to tell my patient to try to lay on their back for the first 2 nights. Not that it's necessary, but it will help. They will be sore and tender. And I also like to educate my patient about arnica. Arnica is a homeopathic agent that we like to put on our patients post-care, and it helps with bruising and swelling. As you can see, she does have a couple baby bruises from this procedure, which is completely normal, but arnica is a great way to resolve them quickly. Here we are again going at that submandibular approach just to kind of lift that cheek up and give it a nice apple to that cheek. So I'm supporting underneath that needle again, going more at a 45-degree angle up underneath that orbital rim, aspirating and pushing again a bolus. When I am coming out, I am making sure that the tissue looks healthy. Capillary refill looks good, perfusion looks good, and there's no signs of a vascular occlusion. Lastly, I like to go through with a little bit of arnica and do a nice little massage and identify what is bruising, what is swelling, and educate my patient where those points are located. Cheek filler is done very tastefully. We did 1 syringe between her 2 cheeks, and it just gave her a little bit more support in her midface.